Welcome to Folds and Curves. I'm your host, Mo Kashkush. Today's guest is Dr. Collin Wolf. Collin is a pharmacist by training and is co-founder and chief science officer at Cassian Solutions. Cassian is working on several interesting problems that you'll hear about today, but at its core, it's really leveraging data and software to improve the way patients interact with the healthcare system. Collin's also a good friend of mine, so his podcast was definitely fun for me. I'm excited for all of you to hear about what Cassian's working on, but also how Collin goes about finding and solving problems. So let's get started. All right, Collin, thanks for joining us. So let's talk about specialty pharmaceuticals. I'm really interested in the entire specialty pharmaceutical supply chain and value chain. I want to hear from you. Who are specialty pharmaceutical patients? What do they look like? What are these drug manufacturing companies who make these so-called specialty pharmaceuticals? Who are they? What kind of drugs are they making? And how are these drugs getting distributed to patients? So we'll just start from the top. What's a specialty pharmaceutical?
Yeah. So at the highest level, there are medications that are made by drug manufacturers, very similar to other drugs. However, one of the big differences is the number of folks that take the drugs, and the cost of the drug is way different than other drugs. So at the highest level, you have not a lot of patients and you have very expensive drugs, right? When it's very expensive and you don't have a lot of people taking the drugs, then you have this problem of, okay, I've paid for this person to take this drug, and very often it's a very significant portion of a plan's spend. What's going to happen if they don't take that drug? So the specialty pharmacy industry is built around the monitoring and the supervision of what happens when you provide someone a very expensive asset. So for example, this very often includes things like HIV, hepatitis C, oncology, most oncolytics. Then you have diseases like rheumatoid arthritis, multiple sclerosis, cystic fibrosis, anything that has a high margin to it, typically today has been seen as specialty.
Okay, so there's clearly like a financial cost or waste if these expensive products aren't being used as prescribed, if adherence is not high in these patients. Are these diseases special in any way where if the patient isn't adherent to their medications, where there's potentially more consequences than you would, for example, if you're not taking your statin every day as prescribed? Are there stronger consequences for these diseases?
Yeah, and I think from a disease perspective, if I'm a patient on a specialty medication, the consequences are quite dire. And for that, we do see a higher baseline level of adherence and compliance relative to other diseases. So to that end, yes. The most pertinent example to Cassian always is HIV prophylaxis, Hep C. In that context, you have patients where they're on a short course of therapy. If they're not taking their meds on time, it's very dramatic for their health. So the worst thing you want to have happen is to go through the prior approval process, get approved for meds, get your Hep C regimen, and then fail that course of therapy and have to go through all that all over again, right?
Yeah.
So the clinical cost is very dramatic as well.
Right. Let's talk about some of the sort of solutions that Cassian has put together to try to overcome, especially this problem of adherence. I know you're also working on engagement, which we'll go into as well. But what are your efforts involving adherence to make sure patients are taking their meds?
Yeah, so one of the most important things in the specialty space is going back to the health plan sponsoring the drug, sponsoring you, your health. It's very expensive. They want to make sure that everything's being done correctly. So to that end, the specialty pharmacy has an increased burden of making sure that you're doing exactly what you have to be doing at every given moment. And that means being compliant, and that means having the right therapeutic outcome. So the problem that we see in specialty pharmacy exists across the market. So essentially for each patient that you have to contact them frequently, once a week, once a month, and make sure that they're on their meds, they're reporting their clinical outcomes, and that requires you to have a staff of folks on call. As especially pharmacy, very often these are registered folks, these are clinicians, these are nurses, whoever it may be, and they have to have meaningful and impactful engagements with those patients. So the biggest problem that we've seen, and it's always kind of fun, is it's very hard to get off the ground. Like, most of these folks don't even have effective phone numbers for their patients. When we go live with a pharmacy, most of the patients don't even know that they are patients. So that the problems that we're sitting here talking about this massive distribution network and all this money involved, but very often the patients don't even know they're a specialty patient. So who's going to communicate those products and that information back to that patient? So for us, we're really looking to make sure that the patient has that connection with the pharmacy. So that means when the patient gets prescribed medication, direct to mobile, instant communication, the patient can report side effects back to the pharmacy. You don't have to have a constant staff calling patients and making sure that they know what's going on. It's really just bridging that gap. And we've seen that with all products. It's you might have a health plan with 1 million lives. You might have a specialty pharmacy with 100,000 patients, but they don't even know if it's a home phone or a cell phone or what emails are live. Right. So the problems are always more rudimentary than what we'd hope.
Yeah, so it almost seems like something that is, fundamentally pretty simple. Calling someone, making sure they're taking their meds, getting those outcomes you talked about. But getting it right can be pretty expensive, right? I mean, you mentioned clinicians spending lots of time calling these patients. So in the case of a pharmacist, that's a person that's making about like 6 figures annually, and they're spending time calling dead numbers, right? Or even if it's a live answer, how long does that phone call take? And, is it being efficiently managed?
Yeah. One of the most shocking things to me is how, if you look at a specialty pharmacy's roster for the day, or the patients they have to call on that day, sometimes it's only a half of the calls go through, only a half of that communication need is met. And then once you factor in the next thing is, okay, we've contacted the patient, they've talked with us. Maybe the patient wasn't up to date on their meds. Maybe we just ran into an immediate snag. The time wasn't used effectively. So basic, and very often just the most rudimentary improvements have the largest thing. So if you think about if a call it's being made, typically you have the onboarding call, it could be like 15 minutes, then you could have a basic assessment, adherence assessment, like a check-in for things like Hep C that's more pertinent. So in Hep C, probably once a week you want to call a patient and make sure they're compliant, because it's only a short course there. Things like HIV can be longer, other disease states. And then you have like probably once a month, once a quarter, a longer clinical assessment. So as you can imagine, as your pharmacy scales, the burden goes higher, especially when you have accrediting bodies that demand more from each pharmacy and the types of services they provide.
Yeah, so I mean, when I think about scale and these sorts of like rinse and repeat type of services that these specialty pharmacies are offering, I think of like tech-enabled outreach, and I know that's what you're working on in one respect. So you're doing one of the things you're working on is you're using machine learning or AI to help optimize this outreach process. Could you talk a little bit about why that makes sense and what you're doing in that respect?
Yeah. I think a really important place to start with this is thinking about, how do you want to be communicated with? What excites you? And when it comes to patient engagement, what is your tolerance or your radar for just noise? So it's very hard to get excited, and I could totally understand this, to have a communication from a specialty pharmacy. And to pretend that the basic communication is exciting, you might fall into some trouble there. So the problem to be solved, it's not the fact that it's AI, it's do we really understand how and when patients want to communicate with us as providers, as pharmacists, as a company. We can see stats like patients are ready and willing to communicate with our business, but it really comes down to, can we understand them? Can we learn from them? So the AI and the machine learning that we have, it understands when and how patients communicate with us, and then also informs our communication to make sure we're communicating back with them the same way they prefer. And to be real simple about it, it's, does a patient want to text at 8 in the morning? Do they want to email at 4 in the afternoon? Are they more likely to respond to the email at 4 in the afternoon? These are all things that are currently manual processes that if you talk to a team, it's like, oh, we do that. But that's really just the smart guy in the office that understands patients and has that relationship. You don't want to lose that relationship when you move to digital. So you want to make sure that when you transfer to a digital world, these elements transition nicely, right? And you don't have to lose that personal touch. So
yeah, I think the personal touch is important, and I think the way people want to be communicated with is really nuanced. It can be difficult to predict. It's not the same every day. Like, for example, if I'm a patient, I might want to have a really in-depth phone call with a clinician about a certain issue I'm having. It's not going to be easy to describe in like some sort of a text format. It's not something that I can do on a checklist. Like, I really want you to understand where I'm feeling it on my face, for example, if it's something like a pain point.
right.
But if it's something like, did you take your meds the other day, or making sure you're adherent, that's something I'd be more comfortable, like a yes or no communication, some sort of a checklist, something that's digitized. And so I think, and that's also just me, and other people have different sort of behavioral patterns and preferences. So I think, is that one of the reasons why AI sort of lends itself to this thing, because each patient's different, because there's a lot of these nuances and complexities in how people think and their preferences?
Yeah, so there's a role that, like, I'm sure you're familiar, AI is just human bias written in code, right?
Mm-hmm.
And we can bias a system to understand patients more holistically, where we can communicate with them at the right time. We can bias a system to send the right engagement to that patient at the right time. Like, are we asking them the right clinical assessment when they're more likely to have moved to a new state, or if they got unemployed? Can we capture these data elements and make sure that we're getting the more recent information that we can address holistically? But the thing is, you really don't want to eliminate people out of the equation, because they are the people that act on your care needs. They're the people that review these assessments. They're the people that can understand the nuances of care. So when we think about smart and intelligent systems, it's really, how do we capture information in a way that's friendly and that's responsive and that's engaging? But how can we also escalate important stuff where a patient says, I am having more problems. My pain has escalated. We are getting in trouble here. I can't afford this. And the solutions that you have on your website aren't helping me. Those are the things to bring a human back in the mix. So
yeah, so
currently machine learning, yeah.
Oh, go ahead.
So currently we can get better with machine learning. We can do a lot more than we have been doing, but it's not going to, in my eyes, replace clinicians anytime very soon.
Right. Yeah, and I think that makes sense to me. I mean, we'll see. So I guess one question I had was, what is omnichannel engagement? Is that what you're talking about with like the texting and the phone calls?
Yeah, and I think that's, you understand that in healthcare, there's 100 different terms for everything, and each time you use it in different contexts, it means something else. So we've seen omnichannel mean a whole bunch of things. So omnichannel can be things that are text and email and web and mail and pamphlet and phone calls, and that could be omni, right? That could very easily be omni. But in our context for digital, the main things that we're focusing on is it over text as the most friendly? Is it over email as the most widely used for standard communications? And then can you also do an app? Apps traditionally have very poor download rates. They traditionally have very poor retention rates, but for the patients that do use apps, they can be very important. So our perspective is use the best engagement methods that we have at our disposal, and then use those to channel immediate clinician and healthcare insights where you can employ that phone call if you have to and if you want to.
Yeah.
So that's our perspective on it. And it depends on your needs, right? Like many places, they still rely on mail heavily for good reason. And the funny thing is when you use a service like ours, we are very competitive with stamps. So if you're currently sending out envelopes, typically a digital solution can cut costs relative to stamps. So
Yeah.
it's all interesting stuff.
So what's like the output of this digital interaction or phone call? It's you're checking with the patient, but on the plan side of it, what are they looking to get out of all of the accumulation of all of these outreaches or communications? What kind of data is being collected that's helping the plans, I guess, perform better?
Well, it all depends on. So when digital started, you had a whole bunch of solutions that were open-ended, where we're going to solve all your problems, all your worries are going to go away, just use our application, patients are going to download it, it's going to be great. And then a lot of companies bought on, like, we have an app now, and everything's solved, and a lot of them are still pushing apps. Some of them work great. The problem is a lot of times a lot of those visions fell short. Think of these products as tools and have your outcome very clearly defined before you start the process. So when we look at what we do, like, number one, specialty pharmacies, what are they looking for? They're looking to make sure that their call staff isn't overburdened. They're looking for standardized data outputs. They're looking to make sure that for all of their patients, there's a very clear understanding of how they're communicating, when they've communicated, what the patients are communicating, saying back to them, and what that story looks like. If we're talking PBMs, you want to make sure you're close to the dollar. So you want to make sure that there's an immediate ROI in terms of providing the service. So for a PBM, this could all be things like, are you helping eligible patients on chronic therapies get to mail order? This is saving them money, communicate the value back to them. Are you helping patients that are on branded drugs go to generics? Like, we know for something that helps plan too is if you're a patient on depression meds and you're taking a branded drug, that's one of the higher predictors of non-adherence. So we hear, right? And if you get that patient on generic, they're much more likely to stay on because it costs less. So there's so many things that, so these are just two examples of the PBM, and that one ties into plans. Bucket number 3 is, are patients effectively utilizing their payment options? Do they know what tools are at their disposal? And then specifically for a plan, plans are really good at knowing what their problem areas are. If you're talking Medicare, then you have stars issues. You want to make sure that for your diabetes population, for your cholesterol populations, high blood pressure, that you have a very clear understanding of how they're communicating back with you. So once you go into plans, you're typically more involved in the clinical world, and you're solving high pain areas in clinical spaces there. But it's really, what is your desired output? Are you using the best technology to get there? And are you leaving and understanding the data bread trail along the way? So
Yeah, so as a company, it sounds like you have to keep in mind all of the needs of all of these different parties, right? Yeah.
Yep.
I want to go back to a point you made about the options patients have. I mean, I think this is like such a critical point, which just in general, I think drug affordability is such an important problem that, I think we're failing on here in the US. And so, and you mentioned the relation to adherence. I mean, the more expensive something is, if it's a brand name versus a generic, the more likely a patient's not going to be able to afford it and probably not be adherent to it.
Mhm.
Um, so what options do patients have? I mean, what options do they have now?
Yeah. So this is very interesting to me. When you drive patient consumerism, you decrease costs, you make them more compliant, you save the plan and the PBM money. It's a win-win-win. The problem where the real problem happens is, I'm not going to throw any like chain under the bus here, but when you go to the closest pharmacy to you and your doctor wrote you a script, where do you want the script? Oh, I'll go to my local grocery store. Like, that's the one I
Right.
always use. You go there and your face cream is $500
Hmm.
and you can't believe it. And then, the doctor calls them, oh, I want a generic one. The generic one is like 130, and you can't believe that either. So
Yeah.
what a lot of the vision that we bake into our products is, the patient needs to not just, like, I don't want to drive them to a website where they have to be their own advocate. I
Yeah.
want, the minute they leave the doctor's office, to receive a message in their pocket that says, you were just prescribed this. Within 3 miles, this is the cheapest med available, and we're
Hmm.
going to save you $60 today, right? And if we miss you the first time, we want to make sure that next time we got you as well. So it's it's dramatically helpful. And the same thing happens for just finding a physician. Like we were talking about, do clinicians have a role with AI ML?
Yeah.
They definitely do when you like them. If you don't like your doctor, you definitely want to talk to an online chatbot to get your prescription. But if you like your doctor, that's a different relationship entirely. So there's all these things that you can really bake into putting the patients first, making sure they like what they're receiving, save them money. Um, it usually helps most people.
Yeah. So it sounds like patient consumerism. Is that what you would? So is that like a highly efficient economy where the patient has like complete information? Is that what you mean by patient consumerism, or is there more to it?
That's the goal. Giving the patient the immediate access to impact their spend
Hmm.
and their quality of care, right? So from you having a interaction with your doctor, or you being enrolled at a pharmacy that's a client of ours, can we make sure that every time that pharmacy interacts with you, we're not just collecting your data. We're not just mining information. And I'm not saying that like we are. I'm saying it feels like that to a patient. Like, why are you asking me once a week if I'm taking my pills? No.
Yeah,
How
definitely.
about how about you tell me how to be healthier and how to save money, or like these things that actually hurt me? Like, um, one of the plans we were talking to for a family of four, the average their average income is $32,000, right? Drug costs are real. They're not thinking of, they're not so worried about, like, of course I took my pills out of, save me money. Just help me get somewhere that's more affordable. So
Right.
that's the vision.
Yeah, absolutely. I mean, I can't emphasize that enough. I mean, if they're not able to afford their meds, they're probably not going to take their meds, and that's going to lead to terrible outcomes.
Mhm.
So what are you doing on this drug affordability front? I know you mentioned wanting when the patient leaves the physician's office to get that notification on their phone. Could you tell me about some of the work you're doing with PBMs and discount cards?
Mhm. Yeah, so step one is, when it comes to companies that offer discount cards, think about a discount card patient. Who is the ideal candidate? These can be folks that are on discrete meds, right? Discrete can be things like things that you don't want to show up on your bill for your family to see. So you can see a lot of personal type medications. And then on the other hand, what you see is folks that are having trouble. So these are folks that were recently laid off, folks that are having financial issues, might be underinsured, and they're pretty good shoppers. So if they're willing to go and find a discount card that helps them, they're also more likely to go on and find the best one, right? When we talk to folks that offer discount cards, when you think about a discount card like any other business, it's a funnel. Awareness, what's awareness, understanding, retention, all those things. So you want to move them down the funnel. You want to help them
Until
go
you
from
close the deal.
I found a discount card. I'm gonna download it. I'm gonna go to the pharmacy. I'm gonna use it. I won't be switched, etc. So very often it's not mapped from a patient perspective. So the first thing is, can we show a PBM, a pharmacy, anyone that wants to help folks save money, exactly where patients fall off the funnel? Are we giving them the card? Are they printing it out at home and they're not remembering it to take it to the pharmacy? Are they taking it to the pharmacy and it's being switched at that layer? So we help patients by sending them discount cards direct to mobile over an interactive experience. So instead of you having to print it out and make sure your printer's on the Wi-Fi and connect the Wi-Fi, you get a text once a month based on your fill to say, this is the most recent discount card. This is the most affordable meds. If you go here, it's gonna work better. Let's go. Right. And if we missed you, we'll also ask you, like, did you already get your prescription this month? Yes. Okay. We'll follow up in a month. Right. But the key is at every one of these points, we can go back to the PBM and say, this is where we're not serving our patients because you weren't competitive with cost here and they fell off the funnel here and they got switched. So let's figure out the right way to do that. So maybe it's a targeted message. We talked about machine learning. We talked about AI. Maybe it's just being a little bit more competitive for that drug if they want to change some things around. So fill the funnel, help folks out, understand where they're falling out, where the problem is, fix it.
Yeah, absolutely. So you're providing visibility into that funnel, which I guess previously people were just falling out of and no one was really sure why. I mean, hey, we're giving you money, we're giving you a discount. Why aren't you using it? It's kind of like confusing, right? But you're providing visibility into some of the problems that patients are having.
Yeah, and it's as simple as, like, problems can be broken down to operational, financial, understanding, right? Can I get to the pharmacy that's going to save me money? Is this going to save me enough money to use this card? Do I understand what I even do with this? Like, if I just click a button on my laptop, am I just going to magically save money next time? No, but we see these problems. So just getting that last mile is always very important.
Yeah. So I think this issue of discount cards, and I do want to get into a little bit if we have time about how they work, but I think it brings up an interesting point about you, like personally, which is that, I mean, first we were talking about communication. I mean, you said it yourself. It's not like the sexiest issue in its core. It's just something you want to get right. You talked about engagement and adherence. Kind of fits into a similar bucket, although I do think adherence is one of those like billion-dollar problems a lot of people are trying to solve. But now we're talking about discount cards. And, you know, I don't think people really know about these things. I didn't before I met you. You know, no one really understands some of these problems and they're hearing about it for the first time with you. So I'm curious from your perspective, how do you find out that these problems exist? Because I don't think many people even know they exist to begin with. What's your process to finding problems and then eventually getting towards a workable solution?
The goal is, can you dedicate time on calendar to learn from businesses and the people who run those businesses and the people who manage the finances of those businesses and say, what hurts you, what helps you, what's most important? If you, as a person, if you're involved in business, one of the most effective things that we do is simply asking someone, we think we're solving a problem in your field. we're not going to tell you, like, I'm not going to tell you exactly what it is, but I just want to hear all of your problems. And I want to hear the most problems if possible. Can I interview you for 15 minutes?
Yeah.
And you hop on a call, and your only job is to absorb and retain and ask, like, for the first problem they present, are you just telling me this problem because you think you know how to solve it? Or is this the thing that's going to actually help you, like, with your business?
Okay.
Can you distinguish, is this just going to save you money that you're losing, or is this going to make you more money? How, like, what things help you grow your population base to the largest? What things help you, manage your costs as much as possible? You almost never get slimy, because when you're helping patients in these businesses, they're always drawn to my offering, because I'm doing them a service, which is usually saving them money, communicating better, showing them what benefits they have, making sure they receive them. That's usually always the problem. So typically, on my calendar, I try to dedicate 5-10 meetings a week, different industries. So you have, especially pharmacies, you have pharmacy owners, you have PBMs, you have PBAs, you have discount card companies, you have third-party administrators, and you have, let's hear the problems, right?
Yeah, and I think it's important that it's not just like a principle, but something you put on your calendar too, something that you make time for on top of your already busy schedule. I mean, running this company, Cassian. So in these interviews that you're having with these people in different industries, um, do you feel like more of a journalist or more of like a detective when you're asking these questions, or neither? I mean, it sounds like you're not satisfied necessarily with the initial answer they give you, and you always want to like dig deeper into it.
I would say it's more of a detective. I like that question. It's, I almost have to hear something 10 times before I really believe it's a problem, right? Like, that's most recently, we just finished interviewing over 25 PBs, right? And some of the problems weren't really problems, and some of the problems were, yeah, anyone would love to have this solution. Like, sometimes you have, like, we're just walking through these things, and someone asks us for a silver bullet to adherence.
Yeah.
No, like, that's really not, oh, you have a perfect solution for adherence. You can tell me exactly all my patients take their pills, right? Then I'll pay for this. No, you want to hear the same problem time and time again, back to back to back. And sometimes you have to understand the core business and what drives them to make sure that it's actually a priority for them and they want to be solving it. And a really, really interesting insight is, the more willing people are to tell you their problems, the more likely it is that you can get their attention enough to hopefully solve their problem. So if a business can sit, like, if they're willing to sit down with you and talk to you for 15 minutes about this problem they're having, they're more likely to try to solve that, right? And if they have invested in something in the past and it didn't work as well as they wanted to, it's more likely they'll be trying to do it again, right?
Yeah, that makes
So
sense.
there's a bunch of indicators to show you if a problem is actually a problem that they're trying to solve, or just something that they're just going to burn through year after year. And you want to make sure you're focusing on those indicators.
Gotcha. That makes sense as a way of like qualifying the problems, so that you don't have to try to deal with every, so-called problem that may or may not exist. Great. So, yeah, I love everything about that. And I think it sounds like something that requires a lot of iterations and, a lot of patience, to get to where you want to go. I do want to circle back to discount cards. You know, this is something that's interesting to me, and I still don't really quite understand how they work. So maybe you can help me out here. Like, obviously, the way it's used is the patient gives the discount card to their pharmacy, and they receive a discount on their medication. But what is going on in the background? Like, who's paying for that discount? You think you could help explain what a discount card is on the back end?
It's endlessly confusing. And the problem is, you have so many intricate offerings that kind of overlap. As someone that is focused on the patient experience, I don't get too far in the weeds with all of the background scenes data pieces. So I think at the highest level, a lot of discount offerings are intended to improve stickiness of the retail offering. So like between a PBM and a pharmacy, they have a relationship where if my PBM can drive business to your pharmacy, then we'll reduce the cost of your discount rates, et cetera. But I'm really not the guy to ask, because typically the only thing that we do is we just figure out, okay, for all of your patients that you have on your discount card, if they redeem once, how much money do you make as a PBM or a discount card offering? And then if we get them to redeem time and time and time and time again at the lowest price, saving them money, what does that patient value turn into? So that's our equation that we focus on. And I'm really not, yeah.
No, but I think that's good enough at a high level to like understand, it sounds like a PBM is the one issuing these discount cards, and that the overall like incentive structure is to build stronger contracts with their pharmacies. I think even that in itself is helpful because, you're always curious, like who is paying for this? And I think that's the big question I have.
Yeah.
Are these discount cards, how much of a discount are we often talking about here? Is this like making a highly unaffordable drug all of a sudden affordable? Or is it turning a $10,000 drug into something that's like $5,000, but still too much for like a patient who is making $30,000 a year? What kind of benefits are we talking about?
Yeah, across the board, one of the key problems that still persists is almost every PBM I've spoken to mentions that they haven't cracked the specialty market yet from their perspective. Driving patients to get on therapy and stay on therapy is still a big problem. Prior authorizations are a natural dissuasion to patients getting on a specialty product. So a tactic that a PBM can employ, I'm not saying this is a good one, is just by making a prior authorization mandatory for this med and not that med, they drive volume towards the non-PA med.
Yeah.
They don't want to support that. So at the highest level, each discount card company, they negotiate their prices, their rebates, their discount, and they usually have a strong spot and a weak spot. So they might have the best prices for insulin, but not the best prices for statins. Some might have better offerings for specialty. It's not going to drive that specialty cost down to zero, right? You typically want to work with your copay and your manufacturer to get the real savings there. But that's the consumerism part. So for this discount card, for the drugs you're looking for, what pharmacy is going to save you the most for the card, and then what card is best for you, right? And that's where you have a GoodRx thing come in.
Yeah, that's interesting. So, I mean, typically patients go to, at least in the retail world, forgetting about specialty for a minute, typically patients go to one pharmacy to get all of their meds. Now, with this like mobile discount card setup that you have going on, do you envision scenarios where a patient goes to one pharmacy for one drug and another pharmacy for another drug with that complete information?
Yeah, so one of the products that we're really interested in building very soon is batch drug pricing for and with discount cards, right? So can you apply a myriad of drugs to a discount card and find, like, after we apply these 6 drugs, can we get the lowest pharmacy offering to you? That's a really interesting problem to be solving, because if you do it like for one drug at a time, yeah, I can say for this drug and this card, the pharmacy down the road is going to save you $20. That's really important. That's very helpful. But I think one of the things that hasn't been cracked yet is that batch product.
Yeah, that makes sense. So just so I understand this correctly, you're talking about like which pharmacy is going to give you the best price for the sum of all 5 meds if you're on 5 meds, correct?
Exactly.
Yeah. Yeah, that sounds like one of those like mathematical problems that increases by more than the multiplier. Like if you have 5 drugs, the complexity of the problem increases by more than 5x, many times more than 5x. And yeah, I think those are interesting problems, and it definitely sounds like a challenge to solve. Yeah. So, are you still working on this smartphone, the pill case?
Yeah. So I think with Metatrak, the patient response in HIV prophylaxis was amazing, right? So we would go to Pittsburgh, we'd go to clinics, we'd go to prescribing centers. Step 1 was interviewing patients. Step 2 was doing a small study, and the adherence data that we were getting was phenomenal. So we had 100% transparency into seeing when and how patients were taking their medications.
Yeah.
And then on average, we saw like an 80% adherence for a medication that has a, sometimes 50% adherence. It's quite staggering to be able to say, we know with 100% certainty when and how the meds were dispensed on a timely fashion.
Yeah.
And I can't stress the transient lifestyle enough, where you're mobile, you're moving around place to place. Countertop dispensers don't work for everyone. Thinking about everything like a tool and use a hammer to chop down a tree type idea.
Yeah.
So in short, we're just looking to do the next patient study once we have enough funding to be able to run that next study. The device is robust, it's built. Just the next cohort of patients, if you will.
Yeah, and I'll back up because I sort of poorly introduced the topic to what we're talking about here. So Cassian doesn't just build software; they're also building a hardware product here. And Metatrak is, and I'll let you describe it, but from my understanding, it's a phone case that's very discreet, so it doesn't look like a pill pack or anything like that. It's very discreet, and it dispenses medications at pre-specified time points to as prescribed. And I'll let you take it from there. Like, what is Metatrak?
Mm-hmm. Yeah. When we sit down to figure out how we are trying to help healthcare make things easier, make them more helpful, we really try not to be burdened by how things are today. When we think about what's the best thing from a patient perspective, if we want to make sure they're taking the pills and we want to have them take their pills at all time. For digital, we're talking about consumerism. For things like adherence, we're talking about empowerment, being in control, understanding when and how things need to be done. So when we try to craft the ideal solution, the thing that we stuck with is, what if we could just sit on the shoulders of something that we're extremely addicted to, something that we're never without, something that can cause us to go into withdrawal if we don't have it, and that's our phone. So we want to make sure that for adherence, there's almost nothing that you're more adherent to than your phone. So we devised a pill pack, if you will, a medication dispensing device that sits on the back of your phone that dispenses your pills according to your regimen 100% of the time, on time, simple data collection efforts when you enter the experience. Try to build an ideal, right? And then see where you land. So
yeah, no, I love the way you described it. You're adherent to nothing more than your phone. So I think that's I think it's one of those things where you're like, huh, I can't believe no one's thought of that yet. And it's like it's very elegant. I'm gonna include in the show notes this, like obviously our website, but some images of this device. It's very discreet, it's very elegant, and I definitely hope it works out. I definitely see the value of it in things like HIV prophylaxis, where again that daily oral pill regimen is really important to get down every day. So is there plans at all to think about non-oral medications as well?
Yeah, so everything we do, we think about the digital world. We can capture everything compliance, adherence oriented via digital. At one point, I was going to naloxone clinics, and I was taking some of the administrators and seeing if I could turn that into a product itself. But we're pretty happy with the Metatrak product we have. We think of it again, so we have a core software platform, and you're able to plug in any sort of device, right? So Metatrak is just one of those devices. So that's where we are with that.
Awesome. Yeah, I'm super excited to continue following Cassian. I think you guys are doing really, really important work, and you're coming up with really neat ways of looking at problems and building solutions to them. And again, as I mentioned before, just finding some of these problems that they exist in the first place, I think is really inspiring. So yeah, I'll sign off there. I think, is there anything else you wanted to get, any message you wanted to get out before we wrap it up?
No, very thankful to be on here. Very thankful to talk to you. You're always up to cool stuff, so I'm glad to be here.
Thanks, man. Appreciate you being here.
Yeah, thank you.
Turn off this recording now. Hey everyone, thanks for watching. I hope you enjoyed the show. To find out more about Collin or Cassian Solutions, please check out the show notes below, and I'll see you next time.